Hello and welcome to the CUGH Faculty Development Webinar Series, Teaching Global Health Through an Interprofessional Lens. I'm Dr. Jessica Everett, Executive Director of Child Family Health International and Assistant Clinical Professor at UCSF in the Department of Family and Community Medicine. It's my pleasure to be with you today and have an amazing lineup of speakers. Before we launch into this topic, I want to focus on a little bit of the goals of this webinar series. This webinar series is aimed at faculty to help us integrate other disciplines than our own into our global health teaching and understanding. It presents key vocabulary, concepts, and approaches that disciplines use when engaging in global health, and provides case studies and other resources necessary to understand a multidisciplinary approach. We have previous installments, including Global Health and Law, presented by Virginia Rawthorne, Global Health and Anthropology, presented by Peter Brown, Global Health and Engineering, presented by Shannon Marquez, and our latest installment is Global Health and Geography, presented by Robert Hewish. Where you can find these is on the CUGH website. If you go to About and then scroll down to Events and Past Events, you will find the webinar recordings there. This webinar series is sponsored by Child Family Health International, a member of CUGH, and a nonprofit based in San Francisco that works with over 200 universities in over 10 countries to provide global health experiences, field work, rotations, internships, and immersion for undergraduate, graduate, and postgraduate trainees. Please learn more at www.cfhi.org. Today we are presenting and exploring global health and business and understanding how the field of business both applies to global health and impacts global health outcomes. We are graced with two amazing presenters today. Amy Lockwood came from a long career in business and the Clinton Foundation, is now a strategic advisor at UCSF in the Global Health Sciences Department, or Center, and has focused on a variety of aspects of global health, including technology, innovation, management, supply chain evaluation, and much more. So welcome to Amy. Also, we have Kara Palamountain, who is a research associate professor at the Kellogg School of Management. She has been there for over 11 years and excitingly is a finalist for the Team 100 and Change competition, which is the MacArthur Foundation's $100 million plus award. She was selected out of thousands of applicants and is one of 4 finalists. Kara comes from a long background in business and focuses on research understanding the role of technological innovation and scaling, and has led over 400 business students on international pursuits. Welcome, Kara. I'm so excited to have our presenters with us today and grateful that you all are here to enjoy this amazing webinar. And thank you to CUGH for bringing us all together.
Thanks so much, Jessica. It's really wonderful to be here. This is Amy Lockwood. And I'm going to start us off by going through a few slides that just explain a little bit more about what we mean by business and how business can be used in global health. Next slide, please. So let's just start. What do we mean by business? If you just look at a pretty basic definition in the dictionary, business is the activity of buying or selling goods or providing services in exchange for money. And really, the exchange for money is part of the most important part here. In global health, we often mean, when we say business, we often can use that to mean the private sector. And that really frequently means that an organization or activity has a profit motive, is interested in making money. However, there are also times when business principles and private sector strategies can be used without a profit motive. And that can be done by any organization working in global health. And those sorts of private sector strategies can be the functions that we talk about as being part of a business, like finance, human resources, marketing, and whatnot. Excuse me, next slide, please. So the thing that we most frequently consider when you first think about business and global health are the big players, the companies that play a really direct role in providing the products and services that are needed for global health. These are often pharmaceutical companies, diagnostic companies, or companies that are making other commodities necessary to advance the access and efforts that we make in global health. These companies are focused on developing new innovations and then using the market forces to make sure that those innovations are accessible. And by market forces, I mean the economic factors that affect the price, demand, and availability of a commodity. For example, one of the companies on this page is called A to Z Textile Mills. A to Z is a company that's based in Arusha, Tanzania, and they produce a variety of products. But most important to this conversation is that they produce long-lasting insecticide bed nets that are used to combat malaria. They started in this line of business in 2008 through a partnership with Sumitomo Chemical Company. And Sumitomo had already developed this insecticide-treated net technology, but it wasn't getting brought out to as many of the countries in sub-Saharan Africa as it had need for it. And so through a public-private partnership with the WHO, UNICEF, the Acumen Fund, and others, A to Z began an effort to create those nets at a price and a quality that would work to eliminate malaria. It was a really, really great idea. Sumitomo had provided the technology. ExxonMobil was actually working with them and was set to provide the raw plastic that would be used to make the nets. The Acumen Fund provided money. The WHO was there to provide technical advice and make sure that the quality standards were met. PSI, Population Services International, was involved as well to help with marketing. And then UNICEF was there to help with distribution. But this actually ran into some issues. And these are common when you come into public-private partnerships because the efforts around business sometimes cannot work as well as we'd like them to in public sector efforts that we most frequently see in global health. In this case, it had to do with the structural issues of the public sector. And one of those things was that the organizations that put out calls for proposals to purchase the nets were doing so looking primarily at price. The way that they looked at price across all the competition of manufacturers was looking at it on something called FOB, or free on board. And that means they were looking at the prices without including the cost to do the importation or transporting the product from the manufacturer to the customer. And that meant that even though A to Z had a high quality product at a reasonable price, they were disadvantaged because their price didn't look as good as it needed to compared to companies in Asia that had a lower price, but that price would have been increased once you took into consideration the transportation. So sometimes the structural issues of what we do to work in the public sector can prevent private sector companies from doing a really good job in helping us to reach our goals. Next slide. Another way that organizations work in global health are through implementing partners. These are the groups that work to bring health innovations to those that need them most. And some of these are for-profit and some of these are nonprofit, but they all use tools of business to operate their organizations. They all have human resources, finance and accounting, supply chain and inventory management, and even marketing and communications. The organizations on this slide represent a mix of nonprofit and for-profits and are focused primarily on delivering care through hospitals and health centers. One of the organizations that doesn't do this is called Living Goods. Living Goods applied the business model that's been implemented in the US by Avon and Amway. They hire local teams as direct sales agents who visit customers door to door in their communities and sell them health-related products like those insecticide-treated bed nets, essential medicines for malaria or diarrheal disease, personal care products, such as soap or toothpaste or feminine hygiene products. And the community health promoters, that's what they call their direct sales agents, they combat the non-availability of basic health care and the frequent stockouts and counterfeit medicines that happen so often in resource-constrained environments. The team at Living Goods thinks very carefully about business issues, like managing their administrative costs, setting competitive price levels, and collecting data to monitor the demand that they've got for products, so that they can guide the decisions on inventory and even identify potential new products that would be good for a community. Next slide, please. Some organizations use the techniques of the private sector to change the market in which healthcare is delivered. And there are a variety of groups on this page. The one that I worked at and know most well is the Clinton Foundation. And the Clinton Foundation for several years has been known for the work we've done on reducing prices to antiretroviral medications. And we did this through a negotiation process, working with the drug manufacturers to reduce the prices. In some cases, we were able to help reduce the prices by up to 90%. And this was done by forecasting the number of people in the countries who would be on a particular sort of treatment, and then using that information to make large volume orders with the manufacturers. And those large volume orders reduced prices. It was more, however, than just the volume, although that's a really key part of how we can reduce prices when you're manufacturing. Because just like the price of a dozen donuts is less expensive than if you buy 12 donuts individually, when we purchase things in bulk, we're able to get a better price. And you can get a great deal of bulk when you look at demand across 30+ countries. But the other things that happened is that we were able to allow manufacturers to plan their production schedules more efficiently because they had better knowledge about how much of what products would be needed and when. That reduced the uncertainty. And in addition, because the purchases were made by one organization, the Clinton Foundation often worked with a single procurement agent, the companies felt more secure that they were going to get paid because that reduced risk. So there are 3 things that we can do that reduces prices. One is understanding our volume and having larger amounts purchased at one time. The second is having a plan for when things are going to be produced that reduces our uncertainty. And the third is doing things that reduce our risk of making sure that we get paid. Next slide, please. So let's talk a little bit about financing. While donors can pay for healthcare products and services or even infrastructure for health outright through grants, most often, especially significant funding, comes in the form of loans. For example, the World Bank is actually a bank, and while they're aimed at reducing poverty and provide governments with funds in low and middle income countries, the money they provide is through loans, and they expect to get paid back. But funding partners can also help lower the cost of medicines and diagnostics with systems such as co-payments, and this can be done with traditional loans and grants. Another new innovative approach to do this is using financial instruments from business, like impact investing. For example, the Acumen Fund does impact investing, where they make investments with a desire not just to get paid back, but to get paid back in social returns so that the benefits go to the community. Acumen Fund popularized the idea of patient capital. Patient capital means that we bring together business and pure philanthropy. They have a higher tolerance for risk. They don't expect a return on the investment for a very long time. They expect a much lower rate of return. So they're not trying to make as much money back on the investment. And they're very flexible to make sure that they're meeting the needs of the entrepreneurs so that they balance the need of the end consumers, or what we would think of as beneficiaries, with the shareholders who are making the investments. Next slide, please. There's one special type of organization that you might have heard about recently that's based both in business and working in fields like global health. Organizations on this slide represent groups that we would think of as social entrepreneurs. Social entrepreneurs look for the most effective methods of serving their social missions. In global health, this means that they often are developing products and services motivated by the creation of social good more than profit. For example, Gradient Health Systems is a nonprofit medical device company. They equip low-resource hospitals to perform safe surgery. They manufacture, sell, and distribute equipment that they support with clinical and technical training and ongoing customer service in order to ensure that hospitals in developing countries can deliver high-quality surgical and anesthesia care. They're most well known for their universal anesthesia machine that works without electricity or oxygen. So in addition to coming up with a product that was specifically made to solve a global health need, they've also created their organization in a nonprofit model, so they're not required to bring back a huge return in order to keep their investors happy. Next slide, please. I've done a lot of research on thinking about social entrepreneurs working in the global health space, particularly while I was working at Stanford. And this resource, the Global Health Innovation Insight Series, can provide you with a lot more information, including a number of vignettes that explain all sorts of different issues that social entrepreneurs can face. Next slide, please. Because it turns out that global health in business is complicated, or creating a global health business is complicated. A business is a pretty complicated thing to run, but it gets even harder when you've got multiple stakeholders that have distinct but overlapping interests. The patients and providers and payers are not always the same person, and they often have different goals. It's really important to remember all of those things if you want to make sure that your product or service is sold and reaches the goals that you have for it. In addition, and this is hard for a number of people that come to global health with a business background, it's really important to understand that there are a variety of regulations and requirements imposed by each government, and sometimes they're even specific to particular healthcare providers. So it's a complicated environment. You don't just have to go ahead and get one approval or go through one quality assurance process. If you're planning on selling to multiple markets, you need to make sure that you fit into all of those requirements. And that's just one of the aspects of the diverse geographies that have different infrastructure, customs, and market dynamics. And so it's not just a one-size-fits-all operation. When we create a product in global health, we really have to take the global seriously. And then perhaps one of the most difficult things is that there are limited resources. Of course, the financial, but also the physical and human resources that'll impact the requirements for pricing and collaboration, and even what the user needs are. All of these things make it pretty difficult to create a business that works in global health, but it's not impossible. Next slide, please. In the Global Health Innovation Insight series, we identified 6 of the key challenges that you need to consider if you're thinking about building one of these businesses. And in the vignettes, we lay out different examples of things that people have done in each of these different areas in order to give new entrepreneurs a sense for the kinds of things they might run into and kinds of solutions that they might find to address those issues. And luckily, we'll get to hear from Kara now, who will go through an example of one of the product innovations that she's been working on in the global health space. So I'll pass it over to Kara now.
Thank you so much, Amy. And I'd like to put in a plug for those that are looking for terrific curriculum. That Global Health Innovation Insight series is a series that I incorporate in my classes in both a general audience, a non-business background, as well as a business background. It's a terrific resource that's available for free online. And the other thing about that is I often get a lot of students coming to me with ideas about how to take a product or service to market in developing countries, low and middle income countries. And that's one of the first things I have them read, is make sure they read every single case study in that innovation series. It's just fantastic. So I want to talk a little bit about a case study and thinking about the businesses and the business-minded organizations that Amy mentioned. They focused on, in some cases, vaccines, drugs, diagnostics, or medical devices. And this is one slide that I really think says a lot, and let me unpack it here for you. If you look at the steep sloped lines on this graph, in short, the time to launch vaccines, drugs, and diagnostics in high-income countries is much less than the time has historically been much compressed, much more compressed than other global health products. And I think in a lot of cases, this is due to a lot of the business functions that support those high-income countries. And so I want to talk and unpack a little bit about what types of activities could potentially help accelerate the adoption and diffusion of vaccines, drugs, diagnostics, medical devices in developing countries. When thinking about the product development life cycle, there's lots of terms that are used around this, and don't let the business jargon intimidate you. And in short, this is the process. It's a research and development. You know, why should we make a device or a diagnostic or a vaccine? What's the value proposition, and can we actually do it technically? Once you've proven you can do it technically, you need to make not just 100 of them, but you need to make the appropriate amount and consistently. And that's really where manufacturing expertise comes in. The clinical and regulatory function, as Amy mentioned, can be a little different depending on the geography, or in fact not even defined. But it is an important function in the commercialization process of these technologies. And the next, once you have clinical and regulatory approval, the way we think about the next 4 boxes is really marketing and distribution, but the words get thrown around loosely, and so I think it's just helpful to become more familiar with the different terms and the different ways that they're used. But sales, in the case that Amy brought up, they didn't decide to call their sales force they called their sales force community health promoters, and that's certainly another way to talk about sales. Then there's just order fulfillment, training personnel, service and maintenance. All these are functions of a really well-functioning distribution system. So as a high-level overview, this is a commercialization process for drugs, devices, and technologies. It also can be called the value chain, which is a term you might hear thrown out. I'm going to walk you through the process for a specific product in the next few minutes. It was a test that was designed to diagnose infants with HIV. That was the goal. It's called Lynx. I just wanted to put in a plug for another organization called Center for Accelerating Innovation Impact. They have a number of publicly available tools that I also use in a lot of my classes that help entrepreneurs or companies that are thinking about introducing products and services in these markets, in the global health markets. And these are really nice toolkits and guides that can help people. I didn't have these when I was working on the infant HIV test, but I sure wish I had. Okay, so the first thing about a product that a business approach would think about, as well as a public health approach, is how many lives could this potentially save? So in the infant HIV test, when we started working on this, we thought about that, and I want to compare and contrast that with another global health product, so you don't get the notion that every product is the same and every process is the same. So I'm going to talk a little bit about chlorhexidine as well. So in the infant HIV test example, there's about 1.5 million babies born to HIV-positive mothers each year. And there's a high concentration of where those babies are born. So 90% are in a small number of countries. And there's a real challenge with diagnosing these babies, and if they're not diagnosed, they end up with, unfortunately, a good number of them at the time we were developing the test would pass away. So when we started working on this, we estimated that there was a potential to save 115,000 lives per year in 20 countries. And again, this was about 10 years ago we started working on it. Now let's compare and contrast that to chlorhexidine. So this is an antiseptic gel that can be used to reduce neonatal mortality by putting it on the stump of an umbilical cord. And in short, the concentration of chlorhexidine in terms of where it could have the most benefit, you can save a lot of lives for a very few number of countries in the world. But these two products, even though they save a lot of lives in relatively few countries, they're very different. So chlorhexidine would maybe be sold in a more of a retail channel versus a health facility only. And so that makes the business functions of chlorhexidine very different than a laboratory test. The other thing about Lynx is it has an equipment component to it and a commodity component. It's not just you buy one package of chlorhexidine and use it and dispose of it when you're done. The equipment aspect of this makes diagnostic and medical devices very different from a business perspective. So good to note that when you're going through these processes I'm about to go through. Okay, so when thinking about the countries that you do want to target, I think it's very logical to first go to where there's the biggest need. And so in a lot of using the DHS data, which is a wonderful tool that's also publicly available, you can actually calculate the size of your market, if you will, or the opportunity to save lives. But, you know, just because there's a market size doesn't actually mean that is going to translate into demand. So just because you build it doesn't mean they'll come. And so really thinking about the marketing and distribution activities to actually help you achieve that maximum health impact goal is really critical. So in thinking about that and how you figure out how you get a need and convert it into demand, what we found, and I've done this with 400 MBA students, is really try to go visit these countries. So once you down select through the data alone, then try to actually go visit the countries and understand what's required to achieve that demand. So things that you'll ask are, who are key stakeholders in this country? Each country is very different. What roles do these stakeholders play in the commercialization process? As Amy mentioned, there are many stakeholders involved in global health. Not only the end user, but the person that's going to write policy or regulation around the product, the person that procures the product, and the organizations that are available to distribute the product in country, whether that's a government entity or a private sector distributor. But what roles do these stakeholders play in the commercialization of your process, of your product? And what do they think of your product? And really trying to think about the different attributes of your product. Of course, the healthcare worker is going to want the one that is easy to use. The government procurement officer might want the one that's the cheapest. And Amy mentioned the BedNet example of what can go wrong when they're not looking at the full cost. And then you have to kind of think about how your product is set up for each one of these stakeholders. Before you go to a country and figure that out, what I ask my students to do is really write through the questions they have about the commercialization process in a certain country. So I just went through some of those questions, but in the context of diagnostics, these are the questions that we had when we went to Swaziland, for example. So wanting to understand what the approval process was for diagnostics, what the procurement process was, what the distribution process was, you know, how concentrated are the health facilities where we would be installing and servicing and maintaining the product. And then finally, when something breaks, you know, trying to figure out whether there are government offices that help maintain and repair equipment, or do you need to hire folks to do that on your behalf? And if so, what's sort of the maintenance personnel to equipment ratio that would be required? So these are just some questions that might be helpful for those that are going to incorporate this sort of commercialization research in with their classes. The result is that you end up with, in some cases, a very distinct diagram, which lists, in this case, stakeholders at the bottom, and then a sort of a Boolean logic, a quasi-Boolean logic on what the process is. And this makes it seem a lot less arduous for a product developer that may be considering entering these markets, if not for the complexity. The other thing when asking stakeholders what they think of your product, really trying to think about which attributes are really critical for you to have squared away. In the case of the Lynx test, there was a lot of complexity in the testing that we hadn't considered, and that was viewed as a very big con. So that was important data for us to consider when thinking about carrying this product forward or not. The Center for Accelerating Innovation and Impact in that Ready, Set, Launch series that I showed you earlier in the slideshow has a nice little country launch canvas, which can be a really nice guidepost for students or product developers that are thinking about entering this space. But you can see that you think about target user, who is, where in the health system is your product or service going to be? Is it going to be in homes? Is it going to be in health centers? Is it going to be in national hospitals, regional, or district? And then what does that translate to in terms of number of potential machines in the case of Lynx, or number of packets of chlorhexidine that you're going to be able to serve that market? And again, this is where the distinction between need and demand occur. So you might want to do both in this particular box. And then the stakeholder analysis, making sure you understand not only the user again, but all those other stakeholders that surround the users and what the barriers are from their perspective with regards to your product. And then figuring out, again, what would be the next steps with those stakeholders as you move towards commercializing your product. When thinking about facility sales and distribution, I think it's important to think about how that is set up in the U.S. versus or Europe versus how it might be set up in some of these countries. The U.S. sales model really is based on a sales force that is basically goes hospital to hospital and tells people about the product that they're working on, and also figures out with the stakeholders within a hospital how that meets or does not meet their need. So they might, for a laboratory product, they might meet with the head of the labs, they might meet with the head of ER, they might meet with the head of the CFO of the hospital. But the relationship remains even after the product has been installed in the in the facility. And so what that means is that there's after-sales support that occurs to maintain that relationship. And that's critical because if they drop off a product and it's not necessarily maintained or put in the right spot within the clinic, then you might not achieve the benefits that you hope. So I'll give you the example of Lynx, where you really want to put the instrument where the mother can actually get a test result for her baby before she goes home to the clinic. And a good salesperson would understand that that means that the first stop in the clinic should be the phlebotomy room. Right after the consultation room. And in the case of what we notice is that the phlebotomy room or the laboratory is often the last stop in the health facility. But a good sales force would help identify and train and install and make sure that the product is adopted within the facility. In the terms of low and middle income countries, a lot of times systems, sales happen at the systems level, so a ministry might be buying on behalf of the system. And so oftentimes what happens is that after sales support and service that you get in a more traditional Salesforce model is not there, it's broken. But that being said, good organizations will come up with the after sales support models. But the ministries, when you're doing a system sale, are really interested in sort of where in the health sector, where in the health pyramid that device or that product or that service should be implemented. In the case of Lynx, it wasn't necessarily the national reference lab. It was sort of lower in the health system. And so helping a ministry think through that is an effort that a sales force would be proactive about. The other thing with regards to system placement, if you think about placing one instrument in a national reference laboratory versus 500 or 35 in many labs, is just making sure that the ongoing commodities that go along with an instrument are able to reach that instrument going forward. And so what a lot of organizations are starting to do is putting connectivity in devices or having them link up with those that are helping fulfill commodity reorders. And so that's a really efficient way to operationalize not only the supply chain, but also provide data back to folks in charge of surveillance, quality control, and or strategic placement of resources. And so those often could be 4 or 5 people, but again, it's a very efficient way to use, I guess, big data to make better decisions. The challenge with this is that sometimes the mobile networks aren't fully set up, and Wi-Fi is not always available throughout the country. But people are starting to think about how do we arm the devices to do better tracking and record keeping. So all in all, in the past decade that I've been working with different organizations on products that can, how we can get products to accelerate the time from manufacturing to full-scale adoption and diffusion in a health system. It's a couple of lessons that I've learned. It's important to understand the investment case, not only for the people buying your product, but it's also comparing that investment case to others that are working on the same stuff. Why are you better? Always be asking yourself that when you're working on a product. And then in terms of selecting countries and figuring out your focus on many countries or one, really trying to get your break-even volume. How do you hit a volume where you can be sustainable as quickly as possible? That is incredibly important to not go out of business as you're launching a product. And then the countries that you target to hit that volume are critical, and understanding the detailed dynamics of how those countries work are incredibly important. And then finally, try not to go it alone. What partners do you need? What organizations are already on the ground doing things that you could leverage? So if someone has a great distribution network in India and you have one in Nigeria, why can't you combine those efforts and partner together to get distribution to the finish line in both those countries respectively for both your products? And then finally, what do partners need from you? In some cases, you might be working with big diagnostic companies or big pharma, and what might they need from you to be successful in not only engaging their own organizations, but also are your incentives aligned? And I think that's been a lesson that I've learned a lot from. And just because an organization has certain incentives one day, they might change 5, 10 years out. So constantly updating that information is really critical to maintain successful partnerships. So with that, I think I will hand it back over to our moderator to take any questions that you might have.
Thank you so much, Kara and Amy. It was a pleasure to hear your presentation. It was really thorough and helpful. We will now take questions or comments. You can put them in the question box on the right-hand control panel. And if you would mention your location or institution, if you're willing to have that shared with the audience. First question is regarding the claims of impacts of commercial products. So for instance, you mentioned that there was 115,000 potential lives saved if the diagnostic equipment was available for the HIV on that slide when you were looking at catchment. I'm wondering if how those numbers are determined and whether they're assuming that lives are saved if diagnosis is made. Just as a clinician, I know that there's a lot of things that would have to line up to actually save lives after a diagnosis. So in the commercial or business sector, when they're making those types of claims, are they holding themselves to other assumptions, or how are those impacts or potential impacts determined?
Sure, that's a terrific question. Thank you for that. In short, I think these are rough calculations here in the beginning of why is this idea worth pursuing? And you're absolutely right that a diagnosis for diagnosis sake is not important if you don't actually follow that up with a positive result receiving treatment. So those sorts of patient journeys are critical, but really just trying to get a rough size of what the impact would be if you were 100% successful. Of course, after you have reached clinical and regulatory approval and make it through the R&D process, you then get your product out into the market and do a proper cost effectiveness analysis. And sometimes that is done by academics that are independent of the product developer. But it's absolutely critical to have that information roughly in the beginning, and then always be striving to make that a reality as you move the product forward. But ultimately, the rigor that a cost effectiveness analysis or an RCT would provide would answer your question.
I would just add that this is one of those times that it's really important for people with a business background to work with people who have much more knowledge about the content of public health or global health. To build the models to figure out how big the impact can be very complicated. And so that's something that in the business world we learn how to do, to build those models. And certainly that's something that we did at the Clinton Foundation in thinking about the volume orders for drugs. But if you do that without the content knowledge of what the whole patient journey looks like, you can make really bad assumptions. And so it's the combination of both the specific knowledge on the ground and how the disease progresses and what you need to do in order to get from a diagnosis to a saved life, but also the technical skill to be able to build a model that's able to do that over many facilities or many countries and many years. And so that's a great example of a place when working together really makes both of our different mindsets work better for the overall good.
Thank you so much. So conversely, I guess, what kind of accountability is there, either self-accountability or external pressures, to track actual impacts after a product goes to market?
Yeah, I think that's an important question, and I think in some cases I find it more credible when it comes from a rigorous evaluation. So that might be an academic institution that has an expertise in that area. But I think that really it becomes less credible, I guess, the more that the product developer themselves does it. So I think you have to weigh the pros and cons of that. Oftentimes, if a product developer does it, then that can be really expensive, and the cost of that, running that that RCT would then be put into the cost of the product. But if there are other sectors that are already funding that type of work through different channels that can allow the product to remain low, I guess, affordable, I think that's a terrific opportunity for academics and business product developers to work towards the same outcome.
Yeah, and just to add to that, I think the business perspective would say if we're selling product, it's doing well. That's again, if we have just the profit motive. When you put the impact motive on top of the profit, then you need to be looking at I think you can still rely on, if people are purchasing the product or organizations are purchasing the product, that's a pretty good tell that the product is doing good in the world. But to be able to say that it's having the advanced impact is another place where, as Kara mentions, working with academics or other organizations to do those evaluations are important. That often is a requirement when you have funding that comes from organizations like the Acumen Fund or the Omidyar Network that are interested in impact investing, because they're not just looking for their investees to report back on the money that came back, but they're also looking for information about the social good. And so that often can get built into the impact investing world, and certainly is put into the grant making world.
Excellent. That's super helpful. going to that kind of impact investing world, I know there's a wide range of ROI that's expected for investors, and you mentioned one model that was a nonprofit model where investors would have less expectations than a privately held company or a publicly held company. Can you comment a little bit on how you see the sector of social investing, impact investing, and where are people settling out as far as what ROI they're expecting in order to invest?
That's a great question. This is a really dynamic field that is growing and changing almost on a daily basis. And social investing goes all the way from the basic idea of just investing in private organizations that are aligned with your belief system. So that most often turns into not investing in companies like those that are selling tobacco, alcohol, firearms, etc. But it can go all the way towards something that looks much more like grant making and putting funding into a project but expecting it to get paid back over time so that you can then reinvest it in another grant in another social organization. Most of the time, impact investors along that spectrum, the further you are towards the more traditional, the higher the investment return you're trying to get back. And so if it's coming from a mutual fund or something that is built into something like all of our 401ks or stock portfolios, if you have them, where it's your personal nest egg, then people are really thinking about getting at least a return that's equal to the average of the stock market. And unfortunately, I don't know what that is right now. But if you're doing it for more of trying to build the social good, then you're really willing to take a return that's as low as zero, and just saying that you get the actual just principal, just the amount that you gave back. And in some cases, it's even good for people to get less than zero because they're getting some of that money back, which makes it different from a grant. And remember, a grant, if that was an investment, has a negative return on investment from a financial perspective. So the grant only receives social impact, which is a perfectly good and rational decision to make, but you need to know that up front. If you're making impact investing, then you are expecting some sort of financial return over zero, but there are people that are willing to take slightly less than zero to get some of their money back to reuse it. And then folks generally will go up to like a 2 to 5% return is something that I've heard of being an acceptable rate. All of that's hard to know up front. You can do as much modeling as you'd like, but you really have to have your hands on all the detail of your financing. And that's tough to do when markets are shifting. We see that that's certainly tough to do for private sector markets that are not trying to work in more difficult environments with lower returns per dollar spent. And so it's even more difficult to do when you're balancing between financial and social returns.
Yeah, and I'll just add to that, Amy, real quickly, just as there's, for those that are used to working with donors or the grant-making community, you know that each donor is different and they have different expectations and different amounts of grants that they might provide. And the same is true in the impact investing space. There's a variation in impact investors out there. Some are finance forward, impact second. Some are impact forward and finance second. One resource that people might be interested in is, again, that USAID, I feel like I'm giving a commercial for them, but they have this Investing for Impact on their website, which is a great resource for people that are new to impact investing. Also, I think there's a great website called the Global Impact Investing Network, GIM, that can be also a very good intro to impact investing.
Excellent. Thank you so much. If you have questions, please put them in the right-hand control panel question box, and we will ask our presenters. Another question is more on the micro and macroeconomic / business development in country. So, Amy, you were talking about A to Z in Tanzania, but I'm wondering your thoughts more generally on the role of business development at the community level in low and middle income countries, and how that has impacts on health, or how health has impacts on business development.
Yeah, so there are two, I think this is a really interesting space because it's one of those places where you can see the expanse of building a business and having impact on health, but also having impact on other parts of development. So A to Z is a great example of an organization that not only was creating a health product, but it was also employing a large number of particularly women and helping them to move forward both in their careers, but also have a livelihood that allowed for their families to do better, for their children to go to school, for them to be able to access the health care they needed. And so by having businesses that are built in the countries where there is need, you not only are able to create a product that is filling the need, but you also are creating an economic generator within the country. So often we think of global health and development as still being something that is coming from the global north and going to the global south. And I think that the business community is a little bit behind on this, where we're still thinking that that's the model. But there are some really nice bright spots of organizations like A to Z. There's also the Botanical Extracts Limited that created artemisinin-based treatment for malaria. Again, that was based in Kenya. So working with farmers that were then able to use their product and turn it into a drug that was necessary in the country in which they were planting the artemisinin. So I think that that's really the direction to go. But the other thing to know is that even multinational corporations can do good when they're operating in these countries. So, for example, ExxonMobil really does, you may have questions about them overall or environmentally, but they really try to make sure that the folks that are working for them have access to healthcare. And so they've built up their own clinics in the countries where they work so that their workers are able to access care very easily. And that was a real forward-thinking movement, particularly in the early days of HIV. So there are a number of ways of doing this, but I would really encourage that as you're thinking about building a product, one thinks about doing that as close to the population that will need it as possible. That's not always easy to do depending on the technology that you are using, but it's certainly a good practice and one that leads to impact that goes far beyond health.
Yeah, and I'll just add 2 points. I think the first is I think there's a lot of investment and excitement on the continent of Africa in biomedical engineering programs at universities and developing those and really trying to think through developing the curriculum for those that is action-based, where students get a project and it's focused on a real-life problem. That's been a revolutionary shift for biomedical engineering programs here in the U.S., and it's nice to see BME programs incorporate that model. Specifically, Northwestern has been working in Nigeria to do that with the University of Ibadan and University of Lagos, but I know a number of other groups are working on that. Rice is very active in Malawi and with the Malawi Polytechnic, and they even have a low volume manufacturing of phototherapy lights now occurring as a spin-off of the university. So it's very exciting to kind of see that enthusiasm for biomedical engineering developing on the continent. As for manufacturing expertise, I mean, I've definitely visited a world-class manufacturing facility in Ogun State in Nigeria for chlorhexidine, and I was really pleasantly surprised to see manufacturing happening there. And I think there's also a lot of great activity in biomedical engineering manufacturing happening in South Africa, which wouldn't have been the case a few decades ago.
Great, thank you. I wonder if you'll comment on the role of political stability or instability or other geopolitical considerations when examining the role of business development, product development, and economic development, and sustainable impacts on global health?
That is a big topic. I think that, businesses are often, as I said, when we look at ways that businesses think about where they produce, we want to try to maximize volume, we want to minimize risk, and we want to maximize the knowledge that we have about what's going to happen next. So making sure that there's not as much uncertainty. And macro political issues can increase risk and reduce certainty. And so that can be really challenging. As we start to see more and more capabilities being built up in local countries, and a lot of that has been there to begin with, and it's just remained uninvested in. So it's not only seeing the capabilities increase, but just the recognition that the capability exists. We'll see that there'll be more and more growth of businesses in general in the countries in which they operate. And I would hypothesize that people who live in a country are best positioned to run an organization that is based there. Understanding the geopolitics of any one country is complicated enough, and understanding the way that politics impact running a business from the regulatory and legal perspective can be a really complicated area to get into. Running a business is you primarily have to think about a number of the legal aspects once you get to the place where you actually are running an organization and not just creating a product that's an idea. Once it becomes up to a scale where you are manufacturing something and selling it at a pretty large volume, then you've got an organization that has to work with the labor laws, has to work with real estate laws, has to work with tax laws, and all of those things change country to country. So I think it can be a great thing that globalization allows us to do work in several countries, and yet having individual, specific, unique understandings of a particular country is really important. And I think that's the best hedge against political instability, is having people that really understand the local environment and particularly the regulations and legislation around it. And then just dealing when different shocks hit the system. And that's something that all businesses have to do everywhere in the world. There are certainly a lot of shocks that are happening to businesses in the United States, some that businesses might like and others that businesses might not.
Great, thank you. So you mentioned CII, and I provided that URL to the attendees. Also, global health delivery case studies were mentioned by an attendee. Could you give us a snapshot of your favorite journals, meetings, conferences, online resources that folks can pursue to continue understanding business and global health?
I'll just start with my favorite magazine, and the winter edition just came out today, and that's the Stanford Social Innovation Review. Yeah. I think they do a really good job of talking about business from the perspective of the public sector and having social impact. So I think that's one of my favorites, and they've got a broad array of both the magazine, but then online resources. They do their own webinars on a variety of topics, and you can find quite a bit of information there.
I think it's a terrific question, and the resources that have been mentioned today are terrific. In terms of conferences, it really depends on what your level of expertise. If you're in laboratory medicine in Africa, I love the African Society for Laboratory Medicine. I think they have a terrific conference that they put on with folks really interested in improving care with laboratory diagnostics. I think for those interested in HIV, the IAS conference is terrific, and I think you'll see you know, a lot of different clinicians that you can interact with and get feedback from not only clinicians but policymakers, which is terrific. There's a SOCAP conference, and I believe even there is a CUGH conference that's happening March 15th through 17th, and the theme is Health Disparities, a Time for Action. So keep that on your radar screen as well.
Excellent.
And then just two other academic suggestions. One is the Harvard Global Health Delivery Case Series. They can get free access to, I think it's 36 different cases that a Harvard team has written about public health delivery systems, often that have a business take. And then Global Health at MIT also has a series of cases, and those are really wonderful as well.
One other quick thing, if you want to really get your hands dirty, the organization CAMTech has various hackathons that they host throughout the world. I think they have one in India, one in Boston, and one in Uganda. And that's a really fun way to sort of immediately immerse yourself into solving a problem that you come up with the first day you attend that meeting.
Excellent. Well, thank you for that, and we would love to see everyone in New York for the CUGH conference. That conference is March 15th through 17th, or excuse me, 16th through 18th, but we have satellite sessions on the 15th. So we'll see you in New York, and thank you again to our panelists, Amy Lockwood, Kara Palamountain. Thank you to CFHI and CUGH for collaborating on this wonderful series. We will be in touch with further installments. Thank you.